across here now. Maybe a little bit of an overcorrection. As I said, I'm just going to leave that alone because I know it'll flatten out. So I'm pretty pleased with that. I might get a little closer here. And when you're around the eye, you do have to be very careful. Sorry. To make sure you're in the right level. Sorry, just a bit. I'm just going to go across this area. I think I'll get a better result. Okay. All right, very nice. And then I'm just going to put a small amount across the nasal bone here. Again, I'm going to go in the mid-dermis here, not quite so deep. Because it's such a fine line. And sometimes it takes a few days or even weeks for the line to press out. The filler's in there, but the line just won't disappear right away. I think we've gotten an excellent response up here in the glabella area. I'm going to turn you a little bit toward me so I can get this side. Okay. I think we're good there now. All right, so I've injected another 0.2 cc's of the Restylane. I've gotten a very nice response here in the glabella area. This defect is almost completely eliminated. And I'm going to have her ice it for a few minutes after this to eliminate some of that erythema, and I think we'll really be able to see how well the defect has been filled. So now I've completed my correction of the defects in the upper face. Phyllis joined us about 2 weeks ago for some correction of some defects that she noticed, and we thought we could help her by giving her some dermal filler to correct the line here in her glabella area. Phyllis did not want to have any Botox treatment, so all of the correction was done with filler. So the line here was filled with some Restylane, and as you can see, there's a great softening of this area. She does keep making this defect by bringing her eyebrows together because we did not get the opportunity to paralyze it, but it's definitely a lot softer and not as deep as it was previously. Laura has some concerns about the horizontal forehead lines that she's developed. As you can see, they're quite prominent. Can you lift your brows for us? And quite deep. Now, this is an excellent area, okay, you can relax, for us to inject Botox, but today I'm going to give her some dermal filler in these horizontal forehead lines, as well as the glabella area where she's also developed some rather deep folds. I'm going to be using a mid to deep dermal filler. It's a hyaluronic acid, And this will help to plump up these lines and help her to eliminate this defect. One of the concerns about the forehead area is if you inject too much and if it's too superficial, you can get blanching and sometimes actual necrosis around the injection from the occlusion of the vascular supply. So even though there are several different ways that the filler can be administered, it could be administered in just one straight line underneath, and many people do that and feel comfortable with that injection technique. I've also done that, but today I'm actually going to do a puncture technique where we're just placing individual punctures of the Restylane along the line to give it the elevation that we're looking for. So I am actually going to put on a magnifier so I can see exactly where these punctures are being placed so that I can be sure that they're in the right level. I don't mind if they're a little bit superficial because actually I've found that that sometimes irons out the defect better. But you have to be careful about the glabella area as well because some fillers will migrate. And you don't want them to migrate into the vessels in this area because that can then get into the vessel supplying the eyes and cause some vision loss. So I am using the Restylane today. I've bent the needle because that often gives us an easier access to the defect when we're injecting. And let me just remove the label. You should always put the label in the patient's chart in case there's a recall or a problem with the filler. Now, I'm not going to try to treat all of the lines today. I just want to do a few of them until we can get a little bit of the effect that we want. It's rather difficult, I think, to see as the filler is going in. But when I get to the deeper lines, I think you'll be able to see better. But I start at the far lateral brow and then work my way over. I found that sometimes you don't get an immediate effect from the filler, and it may take several weeks actually to make the lines start to disappear. But you may be able to see the little blebs along this line, and that will help to eliminate it. I'm going to tilt you, I'm sorry, a little bit more toward me. Now put your chin back that way. Relax your neck a little bit. Excellent. So I'm just going to march along. Often you want to overlay these lines, or sometimes you may want to overlay them with a more superficial filler that goes in the upper dermis, such as a collagen. There are some new collagens on the market that don't need pre-testing. A little pressure there. And there are products that are just for fine lines. Some hyaluronic acids are just for fine lines, but we will not be using those today. The collagens are nice because they sometimes can be used with more of an immediate effect. So if, for instance, the patient is going out that evening, there's not as much swelling associated with it, and they may be able to come in and get a treatment just before going out. These areas with the Restylane have a tendency sometimes to swell or have erythema associated with them. I think if you take a look at these lines, I'm going to turn them a little bit, you can see that already they're starting to look a lot better. Put your head down. Beautiful. And I'm just going to do one more area, that's this area here, and then I'll go to the other side. But I think we're getting a very good response.